So I'm born and raised in Kansas, originally in Kansas City. After I finished my undergraduate degree at the University of Kansas, I transitioned over to medical school at the University of Kansas. I then finished school and transferred down to Wichita, where I did my residency in orthopedic surgery. Following my residency in Wichita, I came out to Colorado, went to the University of Colorado to do my fellowship in adult reconstruction and joint replacements. Following that, I transitioned down to Colorado Springs. In the process of becoming an orthopedic surgeon that's fellowship trained, I completed 5 years of undergraduate school, 4 years of medical school, followed by 5 years of residency, and then finally a year where I spent time doing nothing but hip and knee replacements. So altogether, it was about 15 years of training. So I specialize in joint replacements. Early on in my training, I leaned towards this field because I saw how well patients did with their surgeries. You can take patients that are barely able to walk, and by the time they're done with their recovery, they're back to doing all their normal day-to-day activities, hiking, biking, swimming, and it's really nice to see them be able to make that transition. Originally, I came out to Colorado because we had always spent our time vacationing here. My wife is actually a physician as well. When we met in medical school, every time that we were able to get away, we came to Colorado. And at some point during our training, we kind of looked at each other and said, if we're always there, if we're always vacationing there and always going there, we might as well move there. So when I matched a fellowship in Denver, we knew that I was going to finish my year up there and then transition down to Colorado Springs. When I'm not working, I try to spend most of my time with my kids. I have a 2.5 and a 4.5-year-old. All kinds of normal things that people do here. Love to get out and hike, mountain bike, be out in nature as much as we can. The life of an orthopedic surgeon is hectic and busy, but for the most part it's very rewarding. I'm able to interact with my patients, and I think a vast majority of our patients do very well when they're all done healing, and it's nice to see them be able to get back to that quality of life that they're looking for. Thank you for taking the time to listen to me. If you're experiencing joint or hip pain, please reach out to us. We'll make an appointment.